That's in this area?
Oh yes, beautiful.
Wow, that's
beautiful.
amazing. Great shot. Thanks, Mike. On to a serious subject now. Almost 30,000 men will die this year from prostate cancer, but millions more are living because of early detection. And Dr. Andrew Walker from Mosaic Life Care is here with news on a free prostate cancer screening event the hospital is offering. Doctor, thanks so much for being here. One thing that I was told you really want to emphasize on this is it doesn't take an entire exam. It's a very simple test to screen for prostate cancer.
That's exactly right, Bob. We're doing this just with a blood test. There's no physical exam component to the screening. And 1 in 7 American men will be diagnosed with prostate cancer in their lifetime. And as you said, early diagnosis, it leads to finding cancers at an earlier stage when they're much more treatable and curable. So we really are emphasizing men should come in, get their blood test, and be on their way.
Is it a common misconception that an entire exam is needed or something more than just a blood test?
Well, really it's just the dynamic nature of medicine. You know, we've learned over time that no longer is it necessary to do a full physical exam. Starting with just a PSA blood test, we can get the information we need to direct men whether or not they need additional testing.
And how often does that need to be done? Or is it something where if you've got a history, you have to do it more often, that kind of thing?
So generally we recommend men age 50 to 70 to come in and talk about screening with us. Those men who have a strong family history of prostate cancer should probably consider coming in at either age 45 or 40, depending on their risk.
Okay. Now, when you do the blood draw, is it just the one vial and that's it? That's all that's needed, or are you testing for other things too? And you have to have like
no, that's it.
Several.
One vial. There's a simple questionnaire that patients fill out, and then we'll be reaching out to them within 6 weeks of that test with their results.
Okay, wonderful. Now, when that's done, is it something that we need to, we've got the free event that's coming up this coming Friday from 7 o'clock until 7 o'clock, so it's 12 hours to get examined here. I shouldn't say examined, but get the blood draw to find out. Is it something we need to call ahead for to get an appointment?
Yes, we are asking that patients call the Cancer Center, get scheduled sometime from 7 to 7. It's 816-281-1031.
Okay, we've got a different number on the screen there. Is that number valid
I think
as well?
either one will get you where you need to be.
Okay, all right. So we've got 2 numbers that we can call for
Correct.
something like that. Okay, wonderful. So important that it gets done.
Yes. I think it's a life-saving test. We know if we catch these cancers early, like I said, very treatable, very curable, and we know we're saving lives with this simple blood test.
Yeah. We like to have fun on Live at 5, but there are times we need to get serious, drop dead serious, and this is one of those times.
Sure.
Doctor, thanks for being here.
Of course, Bob.
Appreciate
Thank you.
All right, now back to the fun.